stopping this. I was not looking at anything else except to try and do something that would lead to maybe one life being saved, one life that could be saved. Try to do something like that. So we did whatever guidelines were coming, while we were continuously trying to push for widening the protocols. Please make more testing kits available. Please make automated RTP if it was not being allowed. Should rapid testing kits be used as surveillance kits? They are not tests, but can they be used as surveillance kits? So I was seeing myself in a dark room where I would be participating in taking a decision, not knowing really anything. You don't know. You are testing people through thermal sensors. Is the thermal sensor capable of telling you whether you are a COVID patient? It will just give you an indication whether somebody has fever. And then we are talking about constantly asymptomatic cases, which are 80 to 85% in number. So you have asymptomatic cases, and they are the carriers, and they are basically the ones who would reach those 20 to 60% of the population. They would be the means of spreading this virus to such a large number. So what is to be done? So while protocols were coming and we were looking at one country, we started saying, test or screen much more, not just test. Screen as many more people as possible, put as many more people into quarantine and dedicated facilities, quarantine facilities as possible, because it was all groping in the dark. We got our first positive tests in Chhattisgarh from students coming in from the UK, when UK was not even on the Government of India protocol for testing. It just kept developing. So when we were seeing these things happening, we were looking at the guidelines which were coming, we were looking at the protocols which were coming, but trying to take in as much as we could on the side of caution. So at the time, we even had more than 1 lakh people in home quarantine. About 105,000 people have gone through home quarantine. And we tried to reach people as soon as possible, symptomatic people as soon as possible, so that with the limited RT-PCR testing facilities, we could test those symptomatic people as soon as possible. So we tried to approach the citizens of Chhattisgarh. Please come forward. Don't be afraid of letting us know, sharing if there is any discomfort, if you're having any symptoms. Don't be afraid. Please come forward. And we are happy that we had students coming. Please test us. I am not feeling, but I have come from UK. Please test us. And 5 of those were found positive. They were people who we were able to get confidence of. And they came, a large number of people started coming and saying, we've come from abroad, would you like to test us? That is what we tried to do. And with a very large amount of luck, I'm sure a fair share of luck, we have not had a mortality so far. We've had 59 identified positive cases. 54 of them have been discharged as of now. 5 are in AIMS. AIMS has been a big pillar of support for us. We've been able to work in a very, very coordinated manner. Otherwise, this is Government of India, this is Government of a state, Chhattisgarh Government of India. We did not find any scene. We were able to work very comfortably as a team, and so far things hold good, but it's all fingers crossed. We are not saying we've done anything. We've just tried to do whatever was possible, and we are waiting for that time with large number of people coming in now from outside. It has to spike. Apart from the normal spread, we are still debating whether there is community spread in Chhattisgarh. So far, we've been able to identify only 2 positive cases whom we have not been able to identify to a travel source. So, community spread in Chhattisgarh, we have not yet been able to identify, and yet we say 80 to 85% would be asymptomatic. So, we are living with those realities, hoping for the best, trying not to test as little as possible, try to test as much as we can, and identify people and give relief as much as possible. So this is basically what we have tried to do, knowing there is no cure, knowing that hydroxychloroquine is in circulation. America has come up and said, you better give us, otherwise, you know what. So seeing all that, with presidents coming forward and saying that hydroxychloroquine is the cure, but I am so far we are presuming that no declared cure, whether there is Ayurveda, whether there is homeopathy, or whether there are other means. There are prophylactics. Use whatever you can as a tonic, as something which may support you. If it is given to you by a recognized doctor in whichever field, but knowing that it is not a cure. There is no declared cure in the world. But if there are people, we have Rajiv Bajaj saying that these pills they have helped us. So okay, take them, but take them knowing that this is not a declared cure. If it helps you, so much the better. It is something which will probably not harm you. If a doctor is giving it, he would have seen the side effects. So, Dr. Saab, this is what your a son of a mother from Himachal, we are trying to do. And whatever guidance we can get from this very distinguished gatherings, we'd like to carry it along and try to implement it in Chhattisgarh. Thank you so much for this opportunity.
Sir, you have been very modest in your approach, but let me compliment you. You've done a fantastic job in Chhattisgarh, and all of us commend you for this, sir. Just one more question, if I may. With the little anti-China notion coming in, is the government planning to kind of look at investments coming in to Chhattisgarh because of this? We can have an opportunity out of it.
Investments are certainly open, but see, in today's regime of the GST, states like Chhattisgarh are suffering. We were producing states which were getting revenue from VAT. After the GST regime has come in, our resources are being used. Chhattisgarh, when it was formed, one of the logic or one of the basis rationale behind forming this state of Chhattisgarh was Amir Dharti ke Garib Log. So we had a lot of natural resources, but relatively our people were poorer. So with the GST regime, being a producing state and not a consuming state, we are losing out on revenues. Whoever is producing here, you're producing steel, it is being consumed in Himachal, for example. So the consuming state is benefiting, UP is benefiting, Bihar is benefiting. Our resources are not benefiting Chhattisgarh, the people of Chhattisgarh. So as a country at large, you may say that wealth is being created for the country, so that's okay. But at the expense of not sounding parochial, the resources of Chhattisgarh must also equitably benefit the people of Chhattisgarh. So activities are welcome, but activities which will use the land, the water, the electricity and pollute Chhattisgarh must benefit the people of Chhattisgarh commensurately, and then it is welcome. I am not in favor of relaxing land laws which favor our tribal community. There is a move that you remove this clause that tribal land cannot be bought by a non-tribal. So there is pressure, there has been pressure from the business community to remove that. So I am being frank and I am forthcoming in saying I am not in favor of that. I come from a tribal region, though as such, unfortunately, I am not registered as a tribal. But I can sense their deprivation. You bring in clauses like this and our tribal community will be deprived of their land. People will use it to take over land from tribal communities. So I am not in favor of depriving tribal community of the right to land in the name of doing business. There are many other ways. There are many other places where business establishments could come in. I am not in favor of depriving the Gram Panchayats of the rights in the name of business. I am not in favor of depriving the labor of their rights in the name of business. So reforms, okay. But the priority must reforms for whom? Reforms are not for non-entity, not a non-living entity. Reforms are for living and breathing people. If reforms are to come in, it is not for a subjective entity. It has to be an objective, living, breathing person who must benefit. And again, at the expense of being parochial, we must see that the resources of a state, if they are used for national or even global wealth creation, it must equally, if not a little more, benefit people of that area. So whatever comes, it must give employment to people of this area. It must give income generation for this region, and then let that wealth be shared by all.
Thank you, sir. Thank you very much for your valuable time. It was such a pleasure listening to your thoughts. And I must compliment you once again for the beautiful work that the Health Ministry is doing in Chhattisgarh. Thank you.